So welcome everyone. I have 3:45 where I am. So before we hear from Gregg Orton with our closing keynote for today's event, I have a few logistics to cover. We have everyone muted to cut down on background noise. If you would like to make a comment or ask a question, please use the chat box and send it to all panelists and attendees so the person monitoring the chat doesn't miss it. If there is time after Gregg's keynote, he will answer questions at that point. This session is being recorded. The session is eligible for both Certified Health Education Specialist credit and CE credit from the Medical Library Association. We'll be sending out an evaluation at the end of each day. Completing the evaluation is the first step in claiming your CE. With the logistics out of the way, I'd like to introduce Gregg Orton. Gregg is the National Director of the National Council of Asian Pacific Americans, where he leads the coalition in developing policy and communication strategy and advancing a joint agenda to address the needs of the Asian American, Native Hawaiian, and Pacific Islander communities. Gregg joins NCAPA after spending 9 years working on Capitol Hill for Representative Al Green. He has served as a dedicated advocate for the AAPI community, as well as a mentor for many AAPI staffers in Congress. Gregg hails from Arcadia, California, and attended Vassar College, where he earned his BA in political science. Following graduation, he came to DC as an Asian Pacific American Institute for Congressional Studies Housing Fellow and joined Representative Green's office. He most recently served as the Congressman's Chief of Staff. Please join me in welcoming Gregg Orton.
Thanks, Sarah. Hi, everybody. I've been on enough of these Zoom panels to know that nobody wants to be talked to for an hour, and try to make this a little bit more interactive. If everybody could share in the chat box where they're hailing from, just so I can get a sense of where everybody's from. Usually I'm based in Washington, DC, but I made my way back to Los Angeles to spend time with family. And we snuck away to San Diego for the week to try to unplug a little bit. So it's certainly a pleasure to be with you and appreciate everybody shouting out where they're hailing from. So it's good to see that we're coming from all over the country, which is awesome. So thank you, Sarah, for the introduction, and thank you obviously for the invitation to speak to all of you. And as I said, I really wanted to try to make this a little bit more of an informal conversation amongst all of us about a discussion about the times we find ourselves in, rather than sort of this very strict regimented presentation. I will sort of throw a few slides at you, throw some information, but really it's with the intent of spurring conversations, questions, in a way to discuss these broader issues that we face today. As was mentioned, I'm the National Director of the National Council of Asian Pacific Americans. And previous to that, I spent a good number of years working for Congressman Al Green. A few of you may be wondering if that's the singer Al Green, and obviously that is not the case. He's a wonderful member of Congress from Houston, Texas, but I will tell you, he's not quite the same singer. One of my favorite stories that I like to share is, after working for him for almost 10 years, there was this running joke that he would do, which is if it was your birthday, he would sing you happy birthday and then tell you, now you can tell your friends that Al Green sang you happy birthday. The first time I heard it, I thought it was probably one of the best jokes I've heard, but after maybe the 100th time, maybe less so. But as I said, he's a fantastic member who does great work for the city of Houston, has one of the most diverse districts in the country, and it was always a pleasure to work for him. So to get us started, obviously we find ourselves in this time where everybody's tired. There's real Zoom fatigue, on top of the fact that I think we are all sort of kindred spirits. In working for the Asian American Pacific Islander community, there's just exhaustion in challenging, facing, and addressing this surge in anti-Asian racism that we've seen over the better part of a year. And I imagine for all of you in the public health space, especially on the research side, watching the national discourse around COVID-19 and how to be prepared and how to respond to it, I imagine there's some frustration in seeing just the vast amount of disinformation and misinformation that's out there. And so I imagine, we could probably spend a long time just sort of comparing notes and honestly just venting to each other about just that frustration and fatigue that we've all encountered. So again, I appreciate everybody being here. I see someone from Sheila Jackson Lee's district. That's good stuff. I love it. It's always good to connect with folks back from where I came from. But yeah, we're all tired. And so I think that for me, that's really where I'm coming from, is I want to be able to present to you all information that perhaps broadens our understanding of what the impact of COVID-19 has been on the Asian American, Native Hawaiian, and Pacific Islander community. And really from there, kind of unpack ways in which we can work together, or we can challenge the status quo so that we can do better work for the community. Many of you see at the bottom right the hashtag #WhoWeAre logo that we've been using. And a little bit of background on that is, last year we decided that we should create a hashtag that the entire community could use to sort of rally around, and also just cultivate content on social media if everybody used that hashtag. And so last year was hashtag API 2020. Obviously that's less relevant for this year. And so we really spent some time thinking through, what do we want it to be for this year? And this idea of who we are really just emerged at the top, because people realized we need to sort of reclaim our identity and reestablish what it means to be Asian American, Native Hawaiian, Pacific Islander, and how that's being processed and absorbed and engaged with by the broader public. And so you'll see that logo all over this presentation, but then also we invite everyone to use it. When you're working with or for the community, feel free to use it. We don't own the hashtag. It really is just meant to be a way in which we galvanize people to come together. So what is NCAPA, the National Council of Asian Pacific Americans? We are a national coalition of 37 of the largest and most influential Asian American Pacific Islander civil rights and nonprofit organizations in the country. We started about 20 plus years ago in 1996, when there were 4 organizations working at the national level in Washington, DC, and they got together and said, look, we're not big enough to tango with Congress, with the administration. We can't get the kind of attention we need individually, so we have to come together. And so from there, what started with 4 organizations has grown into 37. And it's been an awesome process to watch. It's been I'm proud of being a part of sort of the effort to build and grow that coalition. We cover as many of the different diverse communities within our broader AAPI community as we can, serving in over 60 languages, 30 different communities. And then through our collective network, we span across 45 states and 3 territories. Now, in addition to approaching it from a very diverse community standpoint, our member organizations also have a variety of policy issue approaches. And so we're not just community-based, we're also issue-based. And so the coalition is structured into a number of different committees, 5 policy committees, including immigration, education, health, civil rights, housing, economic justice. And then more recently, we recognized the need in this day and age to have a space where our staffs could come together and collaborate on social media campaigns and messaging campaigns. So we created a communications committee. The other committee we recently created in 2018 was focused on civic engagement, where we were actively engaged with the 2020 census and nonpartisan get out the vote activities related to the election. And so in many ways, we like to think that we cover a lot of ground depending on the approach we have. And, I was talking to a friend in the entertainment industry about what NCAPA really is. And he was like, oh, wow, you're kind of like the Avengers of the Asian American Pacific Islander community. And I laughed, and then I thought about it. And I realized, maybe that's not too far from the truth. Our members in their own right bring their own brilliance and expertise and unique perspectives to the table. And we really exist for those moments where we need to come together to speak as a unified voice. And like the Avengers, we often spend a lot of time disagreeing, but the important part is how we come together and figure out how to resolve those differences. And so the image you see in front of you are all of our different members. And as you can see, we're diverse in the communities we come from and diverse in the work that we do. Here is the map of our network. And really, I just wanted to share this to show that our member organizations are coalitions themselves. And so NCAPA is a coalition of coalitions. And through our members' respective affiliates, chapters, partner organizations, this is what our national footprint can look like. And so the potential of creating a more unified AAPI movement is certainly there. And like I said, we're very proud of the fact that we've brought different communities and different organizations together to work on the challenges of our time. So the purpose of today is to talk about the AAPI experience in relation to COVID-19. And I don't think this topic needs any real introduction because we have seen sort of what has occurred over the last year across the country. Certainly what happened in Atlanta a few weeks ago and just the tragic events there. The statistic we put there is just to sort of illustrate how prevalent this thinking is around blaming the Chinese government for COVID-19. And what we have been telling decision makers, media, everyone we can reach is, while we certainly welcome a conversation about the geopolitical consequences of COVID-19 and the role governments had in protecting its people from the virus, it's also important to recognize that the rhetoric we use has stoked real xenophobia in America, and it has a meaningful impact and a real detrimental impact on our communities. For me, having done this for so long, I've really struggled with, and I fully admit this, grappling with this reality of what we've seen occur and this narrative that we're always hearing about American exceptionalism. All throughout we're taught history, right? And we're told that America rises to the occasion and meets the challenges of its time. And I've just been shaking my head, and I imagine some of you as well, just this can't be it, right? We can't have over 500,000 people die because of our inability to respond to a virus. We can't across the country see an uptick in racism and blaming an entire group of people for a virus that they had no control over, and a virus that doesn't discriminate against people. And so, I think in many ways that has provided perspective for me in this work, and really sort of reimagining what is possible, but also what needs to be done for this country. But also a recognition that this racism we're seeing against Asian Americans is not new. It has happened throughout our history. If you track history, you'll see all the different ways in which our communities have struggled with structural racism, starting with Chinese exclusion, Japanese internment, the Muslim ban, the response to the 9/11 attack, and then also more broadly speaking, in the context of this racism, it's important to recognize that many Pacific Islanders have been strong supporters of the community and speaking out against it, but they are quick to point out that the racism that many Asian Americans are experiencing are not impacting Pacific Islanders the same way. And so that the language we use, when we say AAPI, we need to be thoughtful about that and recognize that we're really talking about anti-Asian racism. Here are a few more stats. Many of you may have seen this through the great work of Stop AAPI Hate and Asian Americans Advancing Justice, AAJC. It really puts into context what all of us have seen on the news when we're doom scrolling on our phones too late at night, because I know we all do it. Again, these stats really kind of put real context to that. And again, speaking from my personal experience, interacting with a number of Asian American leaders across the country who are grappling with these incidents on the ground level, many of these meetings now have become simply healing spaces. It's supposed to be about talking about the work. But before we can even get to that work, there's real pain, right? There's real trauma. And there's the burden of carrying that in addition to creating a space where your staff can work and thrive. And there's just real exhaustion. And so I was talking to a friend the other day, and they were telling me how they were out for a walk with their kid, pushing a stroller, and a man who was running stopped their run, walked over to them, and just screamed at them to go back to their country. And I think many of us have probably heard similar stories or had friends who have been impacted by this, but it hits differently when it starts getting that close to home. I know for myself, walking out, getting groceries even, going on a walk with family. There's a different level of awareness that has sort of been built over the last year of just wondering, okay, if I run into someone and something happens, what am I going to do? I think there's also a way in which we've recoded our brains, right? If we see someone without a mask, what assumptions do we start to make about them and their willingness to potentially, say something or attack or just confront? And that has carried real challenges for a lot of us. And I like to take a moment just to recognize that because it's something we've all been carrying for, like I said, the better part of a year. I was also talking to another friend in New York, and they were just telling me how in the city, people are afraid to take public transportation because they don't know what they're going to encounter on the subway. But what does that mean for frontline workers or folks who don't have the ability to work from home or have the means to get to work without public transportation, right? I think it's really caused me to think, what does our work really mean and how are we approaching it to really ground local communities, because they're the ones that are being impacted by this every single day. Now, with the numbers you see here, the 4,000 reported cases of anti-Asian racism to Stop AAPI Hate, to me, that's an undercount, because that is a self-reporting mechanism. And we know everybody processes this trauma very differently. And so it's very likely that there's far more cases than this that aren't being reported because some people may just not want to be seen or have their personal story publicized. And so it's remarkable to see sort of this uptick, and unfortunately we expect it to continue for quite some time. There's stories of parents who don't want to send their kids back to school as schools reopen. And I think that's profoundly sad, right? In the sense that we are shaping the experiences of our children, and how are they going to take these lessons as they grow up? How are their views of communities, of our community, going to be shaped by this? And conversely, if you're an Asian American kid, how is your view of society and your neighbors going to be shaped by this experience as well? So as I said, there's a lot of pain, a lot of frustration, and I do think it's important to take that time to really think about it, stew on these numbers, and then think about what we're going to do about it. I want to switch next to this idea of disinformation in our community. And as I said, I imagine this is where the work that you all do in public health and research intersects directly with the work that we're trying to do in the community. Disinformation and misinformation has run rampant in the Asian American community, especially in response to COVID-19. Some of the things that we've sort of seen and monitored on WeChat and other social media platforms, we laugh at some of these examples, but they're real. And I think that's the important thing to remember. For example, there's some who say that there's microchips in the vaccine, or it will alter the DNA of the recipient. The vaccine can cause infertility. There's certainly on WeChat various examples of people saying that we shouldn't trust the vaccine because the Chinese government is saying this. And again, I think it's important to recognize that these spaces emerge because of structural barriers and neglect that happens for the Asian American Pacific Islander community. When the government doesn't provide enough resources to reach these communities with good information, they're essentially left on their own, and this is what happens. And so I do think it's important for all of us to think through, what does it look like to make a more meaningful push for resources and better information to reach our communities? I want to take a moment now to shift gears a little bit, because my biggest fear in this entire experience is that, as prevalent as anti-Asian racism is, and as much as it has shaped the lived experiences of so many Americans, my fear is that it will actually invisibilize the real impact that COVID-19 has had on the Asian American Pacific Islander community. It's important for us to recognize that we are not a single issue constituency, even though this racism is impossible to ignore and needs to be addressed. And so I'll spend the next few minutes trying to walk you through some information that you're probably familiar with in terms of the health impact, but then also on the economic impact side as well. Our belief is that the national discourse around AAPI experiencing COVID-19 has been one that only focuses on the anti-Asian racism and doesn't take into enough account the other impacts that these other spaces have. So again, with health, I imagine there's things that you all could probably teach me, but from what we've observed at the national level in Congress, in the administration, the conversation around health disparities has largely erased Asian American, Native Hawaiian, and Pacific Islanders. With the Pacific Islander community in particular, I think it says something when the community itself has to organize infrastructure to collect data and report on it. That is something that our governments, state, local, national, should have because of the resources. It should not fall on a community to have to do this themselves. But thanks to great work by the Pacific Islander COVID-19 response team, which is a group of Pacific Islander organizations and health professionals that have just taken it upon themselves to do this work, we do have better data, and it has actually helped make the case, a stronger case at the national level, that there needs to be better inclusion for the community. For the South Asian community, thanks to the work of one of our members, the South Asian Public Health Association, we have found that it's very likely that cases are being underreported in states like New York, where there's prevalent, large South Asian communities. But what does that really mean? Again, the community is sort of left on its own to collect that data to make the case. And so we do need to make sure that we're inclusive in how we're talking about the hidden health disparities within our communities, and certainly that includes South Asian Americans. Certainly in California, there are a number of Asian American researchers that have done fantastic work that have helped raise the profile of the community in the state. And we've benefited from a lot of that research. And so recognizing that there has been a disproportionate impact on Asian Americans as well, certainly in California and other states most likely, we've struggled to have this data even reach the desks of decision makers. And when you listen to them talk about it, and they talk about communities of color, you rarely hear Asian American, Native Hawaiian, Pacific Islanders included in that. And so the last data point at the bottom is one that I still find remarkable and sad, in that when we're talking about frontline workers and nurses especially, almost a third of the nurse deaths in this country are coming from the Filipino community. That kind of sacrifice is, you've seen a few stories, but I don't think we've seen enough stories. I think that kind of sacrifice by the community should be recognized. But again, it speaks to just the way the media is covering this, the way the national discourse is moving, in that there's just not enough attention being given to the impact COVID-19 is having on the Asian American community. Moving next into economic impact. This is also one of those sort of invisible struggles for our community. We've also seen a few news stories on sort of the spike in unemployment. And if we're just taking the stats aside and talking about what we have all observed over the last year, Asian American small businesses have been feeling the pain and impact of COVID-19 long before other communities in the broader public. Because I remember last February, when we started hearing these rumors about this virus, and that it was somehow tied to China, we were hearing anecdotally how restaurants were already being ignored or avoided by customers. And so before the shutdown even occurred, our businesses were really feeling it. In Washington, DC, or actually in Virginia, there's this great space called Eden Center that has a number of Vietnamese American owned businesses, restaurants, grocery stores. And we were talking to them and hearing about how there was a legitimate fear that they wouldn't be able to pay rent. And for us, it was a question of what happens when all of these businesses are displaced, when all these vibrant cultural, ethnic enclaves around the country suddenly can't pay rent, are displaced. Will they ever find a way back? Because we know how much rent is, and we know how difficult it is to not only sustain a business, but start one. And so, again, all of these stats point to the fact that the economic impact on our communities is real. And in the public health space, I imagine there's a deeper conversation about these social determinants of health and how all of this ties into probably doubling down or tripling down on long-term health disparities if left unaddressed. Now, I want to go next to some of the actual real life examples of the way in which Asian American Pacific Islanders have been excluded. We can debate as to the reason why. I suspect that it has a lot to do with the model minority stereotype, as well as just this fixation on anti-Asian racism that has caused less attention on these other issues. President Biden stood up a COVID-19 health equity task force. There are Asian Americans represented there, but there to this day remains no Native Hawaiian Pacific Islanders on that task force. And we have spent a number of meetings standing with the NHPI community, challenging that absence and calling for change there. Because without authentic voices from the community making the case of how they're being impacted, we don't believe that that task force can do its best work. Another example, again, with the National Academy of Sciences, when they put out their framework for vaccine allocation, initially, all of our community was absent. And it wasn't until the work of community organizations like our members in NCAPA that NHPIs were added into the framework, but Asian Americans were still left out. With the PPP program, in the initial rollout of the program, it was almost impossible for Asian American Pacific Islander businesses to receive a PPP loan because of, again, the way it was structurally set up. You need an existing banking relationship to gain access to this program. Well, many Asian American owned small businesses don't have access to the banking system. They're cash run, or there's a language barrier that exists. And so again, unless we address this real issue, unless we find allies who are willing to help on the research side and raise up visibility for our communities, we fully expect policy solutions that are designed to help everybody actually end up excluding Asian American Pacific Islanders. So the last portion of this presentation, I want to spend some time talking through what you all can do. And I actually think that you all you're uniquely positioned to help drive this conversation further than many others because of your research background, because of the fact that you are committed to truth and driving real information out to the community. And so I want to start with 3 examples of what you can do. And it starts with really understanding who the Asian American, Native Hawaiian, Pacific Islander community really is, right? It is, I think, far too often when you hear AAPI, there's an assumption that it's people who look like me, right? People who are East Asian. And that is incredibly damaging when we don't take a full view of who our community is, recognizing that there are South Asians, Southeast Asians, Native Hawaiian, and Pacific Islanders that make up this broader community, and they need to be included. And for far too long, historically speaking, they have been excluded. And so we are one of the fastest growing demographic groups in the country. Our buying power is massive. We continue to grow, but also we're largely foreign born, right? In many cases, last year's census might have been the first census that many Asian Americans participated in. And so there needs to be a grounding of an understanding of who the community really is in order to do the work, to do the research that is inclusive, and ultimately do the advocacy that's needed to sort of advance the cause for the community as well. This next slide shows the top 10 states with the highest AAPI populations. And when I talk to corporate entities, certainly there's been a number of sort of stepped up in the philanthropic space. We encourage them to recognize where our communities actually are, and to invest in those actual local communities. For us, it's important, again, and I've said before, the work that's being done needs to happen at the national level, the state and local level. But if you're talking about where impact is really occurring, where organizations are under-resourced, trying to figure out ways to galvanize a community to come together, that's happening at the local level. And so I highly encourage everyone to sort of take this map, take it to heart, and think through what its implications are for research and other work that you all do. The other piece that I'd like to sort of offer as a point of discussion is what actually can be done by all of you. And again, in this research space, I think explicitly questions should be asked. When you're talking about communities of color, ask, are there APIs included? Are the Pacific Islanders included? Are Native Hawaiians included? Are we growing beyond that assumption that East Asians make up all APIs, right? I really think it's incumbent on all of us to challenge that inequity whenever we see it, challenge the assumption of the model minority stereotype, because not all Asian American Pacific Islanders are killing it, doing well, and don't need help. Quite the opposite, as we've just seen. And so I would just, honestly, I would challenge all of you to just take this to heart in the work that you do, connect with organizations like NCAPA and our members if there are questions, because I think in many ways we have watched time and time again where research comes out and we're not there. And we know, look, we know and we'll sympathize with the fact that oftentimes this kind of research is underfunded because the work that we do is underfunded. But until we have a breakthrough in the way data is collected and research is done in our communities, it will be increasingly challenging to convince decision makers that there is a real need for resources or that there's a real impact that's being ignored. Because at least most folks in Congress and the administration will ultimately respect data. Obviously, we can debate that as well. Maybe we've had a departure from that, and that's very unfortunate. But data-based policymaking is still going to be a bedrock, hopefully, over the next few years. And so we need help there. We truly do. This last slide here is actually something individually that we can all do. Going back kind of full circle to the anti-Asian racism that we've seen. Bystander intervention is not learning self-defense so that you can physically defend someone who might be under attack. It is actually just a few actions that you can do to help a victim feel safe. I don't know if any of you have experienced that kind of harassment on the streets, but I know most people are not trained or wired to respond in a way other than just simply shutting down or trying to distance themselves from that confrontation. But if through trainings by Asian Americans Advancing Justice and Hollaback, there's a number of things that we can all do, a number of things we can think about if we are witnessing an event like that to help, again, make a victim feel safe, de-escalate a situation. Again, the training is not intended to escalate, it's actually intended to de-escalate. And so there's a link there at the bottom that I encourage all of you to check out. The trainings are online. They've done a fantastic job of scaling this, and they continue to train more and more folks. And again, the goal being, here are a few tips, pointers, and things you can think about in the event that you witness anti-Asian racism happening in real time to an individual. So I will say that this is the end of my presentation, because I really did want to provide enough time for questions and discussion amongst everybody. But I appreciate the opportunity to speak to you all. Appreciate the work that you're doing, because again, I recognize that research and uplifting communities of color in the context of health research can oftentimes be difficult, but I think all of us have that responsibility to try to do more. So with that, I will gladly stop and take any questions.
Great, thank you so much, Greg. So far, I see one question in the chat that you can start to answer, as hopefully others will add more questions. So this one comes from Srijan. They ask, anti-Asian propaganda and rhetoric today takes place on social media and other web platforms. This damages mental health of those targeted, and these online discussions can even lead to real-world harm, unfortunately. Are there efforts to deal with these problems? What efforts will ideally be needed? So addressing the mental health aspect of what has been happening and also this work.
Yeah, no, I think it's a great question. And, mental health in the Asian American Pacific Islander community is such a taboo subject, right? It's something that we don't talk about. And by extension, we don't talk about enough. And so through many of our member organizations at NCAPA, we are trying to figure out ways to engage the broader community on the importance of mental health, especially in this time. As I mentioned at the beginning of the presentation, there's so much pain, and it's like people are processing this differently. And so I do think more resources need to go to programs that support mental health. There needs to be investments in sort of culturally competent mental health resources as well. Language access is key, because until we actually take this seriously, and I mean we by the country, the government, and practitioners, our communities will continue to be isolated, and these issues will be left unaddressed. And so, I wish I had a profound answer to this, but the reality is that there are a number of government programs that exist for these purposes that are supposed to drive resources to the ground. I believe that not enough is done to make this accessible. And so we have been, lobbying President Biden as well as Congress to really take this issue seriously. And so hopefully in the president's upcoming budget, we'll see an increase in resources for that way. And then putting on my Capitol Hill staffer, Congress has the ability to not designate funding, but provide direction to agencies when they receive funding on how they should use it. And so my understanding is that the Congressional Asian Pacific American Caucus is looking at ways in which they can include sort of that direction language to the agencies to make sure that more resources can go in a culturally competent and kind of language access perspective to communities that need it the most. I would say the second part of this is, how do you sort of police or monitor social media platforms? And as we've seen, that's an incredibly difficult thing to do. It would seem that many of these platforms, take a very hands-off approach to how they moderate content. But the reality is just social media has become this place where you can say whatever you want and pretty much get away with it. And I think that is a problem that needs to be addressed. Maybe, in some ways, maybe it's the anonymized nature of it all, where people feel like they can say whatever it is they're feeling. But it obviously is a problem, because if you go back to that 4,000 reported incidents of anti-Asian racism, I don't think that captures nearly a fraction of what we've seen online. And just again, having scrolled through Twitter myself, there's probably thousands more, tens of thousands more examples of just harassment there. And so what can we do about that is really the question.
Thank you. We have a few comments just also supporting the Hollaback AAJC training. One individual highly recommends it. I think you started to already answer this follow-up question about addressing social media based anti-Asian harassment. What can be done regarding that? So I'll jump to the question afterwards, asking, how do we approach state-specific government policies, such as the non-requirement for mask wearing in Texas, the responsibility on individual businesses to uphold health, safety, and physical well-being safety seems precarious, particularly as you mentioned, there are AAPI business owners dealing with that as well.
Yeah, that's also a pretty tricky question. For us, I laugh because for me on a personal level, it's been remarkable to watch just this resistance to a community-based approach across the country, right? Like it's about protecting each other. And so again, I don't know if I have a good answer for how we instill this sense of community and responsibility for one another in folks in this country who just feel like their liberties are being infringed upon by asking them to wear a mask, right? Or to socially distance. I think specific to the Asian American Pacific Islander community, it goes back to that need for culturally competent resources and, you know, accessible resources, because again, when they're left to be isolated, they're left to information sources that are not always credible. They already feel like they've been in some ways abandoned, and so they will sort of go about it in their own way. But if we can draw them into this broader conversation that's occurring, and I think it's starting to gain traction slowly, about the need to practice, you know, mask wearing, social distancing, good public health practices as well, I think that could make a real difference. And, you know, perhaps not, but we've actually never really tried, because the government has never committed those kinds of resources to educate, you know, the parts of the Asian American Pacific Islander community that are oftentimes isolated. So yeah.
Thank you. This next question asks, excuse me, you mentioned general mis and disinformation going around in the communities that your organization serve. Has targeted anti-Asian disinformation driving AA and NHPI folks and communities away from prevention or intervention? So have you seen disinformation discouraging public health and safety practices?
We've seen, yeah, we've definitely seen some. I think there was some Vietnamese language graphics that had gone out on social media that was really discouraging use of the vaccine, because also if you had COVID, you know, you were immune. And so this fear that the vaccine was basically going to harm you or harm your families really seemed to take hold. And I don't think it's specific to the Vietnamese community. That's just the one that I remember seeing. So I do think that there's real fear around the vaccine itself, and real disinformation around the impact that it can have, that again is driving people away. And without that investment of resources for good information about what the vaccine actually does and how it protects your family, and, you know, here are the risks associated compared to what's being put out there, people are only getting one side of this debate. And I think that's the most frustrating aspect of it, is if we could finally get the government to fund just simple resources in language, you know, vetted to make sure that the language is correct, that could go a long way. And the more time we waste trying to create those resources, the more the disinformation has time to kind of get a head start to take hold. I want to give a lot of credit to our member organizations within NCAPA, the Asian Pacific Island American Health Forum, and APCHO, which is the Association of all the Asian Pacific American Community Health Organizations. You know, they have essentially taken it upon themselves to figure out ways to create the resources that we're talking about. And it's sort of parallel to this idea that the data collection around COVID-19 fell into the hands of the community itself. I don't think that's the way it should be. But that's in reality what has had to happen over the last year. Credit to the Biden administration in terms of really at least signaling that they're going to invest in providing resources and funding the creation of these materials. And our hope is that that can get rolling fairly soon, because again, my biggest fear is just the more time we waste trying to get good information out to the community, just the more time this ridiculous disinformation has to make its rounds and embed itself into the minds of communities that need to be reached.
Great point. Yes, time, resources, and action are critical. So the next question asks, as you've stated, Asian American and Pacific Islander encompasses a wide range of ethnicities and identities. How do we address racism and anti-Asian hate within our identity or community itself?
Yeah, no, I love this question, and it is an existential question for our coalition, right? Because we take seriously the need to include all the different diverse communities within AAPI, if you will. But if we're being honest and we're being real, there's real intra-community racism that still exists. There's a lot of baggage there that needs to be unpacked. And again, specific to the NHPI community, I think AAPI as a term has been adopted because it is inclusive in the language that it uses, but without real practice, it actually does damage, right? Because even within the NCAPA space, we are trying to rethink how we center NHPI communities. How do we make sure they're actually heard in forums where we're engaging with the White House or with Congress? There's a lot of work that remains to be done there. And obviously the same can be said about Southeast Asian communities, the Vietnamese, Laotian, Hmong communities. They're oftentimes kind of pushed to the second, to the back burner as well. And until we figure out a way to really address those inequities, I think the AAPI movement, if you will continue to struggle to find cohesiveness in the moments that we need it, such as right now. It has been pointed out to me that even using the term AAPI, there's a divide in the community. It doesn't specifically name Native Hawaiians, and they're very much a part of the community. And so whether you use NHPI or AAPI or APA, I think the real key is how we put this into practice, right? How do we center these less resourced, oftentimes overlooked communities more, right? And so sometimes that's hard to do because we feel like, some may feel like they're giving up ground where they need to raise their own issues. But the truth is, we need to do better in uplifting our brothers and sisters in the Southeast Asian, Native Hawaiian, and Pacific Islander communities.
Thank you. This next question asks, is the community health worker model used among the AAPI communities broadly or specific community? Have you heard of this model being used in your work?
So I've heard a little bit about it. I'll admit that my expertise is not in sort of the health policy space, and thanks to organizations like the Health Forum and APCHO, we're able to follow their leadership. But I do know sort of this intersection of health policy and workers. Another one of our member organizations is the Asian Pacific American Labor Alliance, and they have been great in uplifting the experiences of frontline workers and making sure that that is sort of connected to it all. There's been long conversations about when you go back to talking about how we are responsible because of the lack of resources to create good resources for the community, having the right messengers, right? And that's especially important in the NHPI community, as well as communities that have high numbers of limited English proficiency community members. And so we have been trying to think through how do you take that model of first creating the resource, but then tailoring in a way that a trusted messenger or community health worker could take it and really run with it and allow people to trust that it's coming from a credible source. So I don't know if that directly answers the question, but I know that has certainly been a topic of conversation amongst all of our members as we're talking about how to address sort of this information gap that still exists.
Thank you. All right, that was the last chat, or that was the last message in the chat so far. So I'll kind of give like another minute here to see if there are any last minute questions. So while folks get those in the chat, I had a question for you, Greg, just to ask, so what is kind of the next step for NCAPA right now? And I feel like a podcaster asking this. If people want to continue like hearing about what you've been working on, as well as the great work the coalition has been working on, what's the best way to kind of keep tabs on what you all have been doing, this incredible work?
I mean, certainly you can sign up for our mailing list through our website. The work really boils down to how do we engage with the Biden administration? And I think in many ways, they're saying all the right things. They have signaled a real commitment to uplifting racial equity, which is, I mean, it's a breath of fresh air, right? But ultimately, time will tell sort of what that looks like in practice and execution by the government. I think we want to be fair to the president and his administration, recognizing just the scope of the challenge that they've inherited. But in relation to our community, it is important to make sure that these erasures or the absence of our communities in these sort of advisory spaces or in how we engage with the president and different agencies has to be addressed, right? And at least for NCAPA, there's been ongoing communication with different federal agencies as well as the White House. And so we look forward to continuing that with President Biden, pushing him to make sure that they're really thinking through how to engage with our diverse communities. I don't know if you've followed, but he recently announced a number of steps in response to the anti-Asian racism, which included a commitment to look at data disaggregation, which again, many of us in this space have been working on for a long time. And it goes back to needing that good data and accurate data on our different communities. And so we're truly excited about this because I believe that this is our opportunity to get this across the finish line. The work started a long time ago, but made a lot of progress under the Obama administration. But frankly, they just ran out of time. They were getting ready to look at a government-wide assessment of how the government collects data and disaggregates it on different communities. But they simply ran out of time. And obviously that work didn't make any progress under the Trump administration. And so we're hopeful that we make, big strides forward and get this finished this time around. So definitely encourage all of you to stay connected with us. We put out a decent amount of updates on sort of what's happening in DC. And then I guess the last thing I'll say is this White House initiative on Asian American Pacific Islanders was another thing that President Biden signaled that he would be committed to reestablishing. And this is an important body for different federal agencies to come together to think about how they're engaging with our entire community. And so we're very much at the early stages of engaging with the White House on how to do this, but it goes back to the need to make sure it's inclusive, it's grounded in culturally competent practices, and also making sure it's being used as a way to encourage other federal agencies to recognize our communities.
So thank you, Greg. There were no more questions in the chat. If you have any final thoughts, otherwise we'll wind it up.
I'd just like to say thank you again to everybody. It was a pleasure spending some time with you. And like I said, I'm happy to give time back. Hopefully everybody has a chance to rest and recuperate and spend time with their families, because it's a challenging time, and I hope everybody's hanging in there. So thank you.
So a virtual round of applause. Thank you, Greg, for being with us today. And thank you all of you for being with us today. We have Martha Meacham is going to give some closing thoughts, and hopefully we'll see everybody, or most everybody, tomorrow.
So hi, I'm Martha Meacham. I'm the project director for the network of the National Library of Medicine. And first, I would like to thank all of the attendees here today. It's been wonderful to see so many people and such great enthusiasm and participation. A special thanks goes to the guest speakers, the panelists, the paper presenters for informing us of the key issues that impact medically underserved populations and their ability to assess the accuracy of health information related to COVID-19 and vaccines. They also learning of different case studies that you may be able to reproduce or in your own community, and then take these case studies as opportunities to design and outreach and education programs for your community. I would like to thank, I would like to thank Dr. Vin Gupta and Gregg Orton for their keynote presentations. I appreciated learning about the current state of the pandemic and how to leverage storytelling to communicate key points and ensure the public's trust. I also appreciated the talk on the rise of anti-Asian American violence due to misinformation due to COVID, and the need for culturally and linguistically appropriate education, outreach, and care. As you have heard, the symposium has continuing education credit from the Medical Library Association and from the National Commission for Health Education Credentialing. You will receive an email evaluating today's presentations. Upon completion, you will receive instructions for claiming that continuing education credit. We hope that you will join us tomorrow for the final day of the symposium. Tomorrow we have the keynote presentation from Jess Colas, Health Communications Specialist from the CDC Global Immunization Division. Her presentation, Debunk or Pre-Bunk, a necessary paradigm shift for addressing health information, will provide an opportunity for dialogue and equip us to address and fill information gaps. Dr. Purnell's talk, The Tale of Two Americas, will look at how Black, Latinx, and Indigenous populations are impacted by COVID-19 and what can be done to support them. Thank you all for attending the symposium today. We look forward to seeing you tomorrow, and have a wonderful evening.